Hi, my name is April. Welcome to my video. In this video, I'm gonna present to you Mr. Bob. He's my model today. I call him Bob because, as you can see, he's a body of bones. So it's B-O-B and it's Bob. Today we're gonna talk about the appendicular bone. But first, we're gonna talk to you about the human skeleton. The human skeleton, it consists of 206 bones. Right here, Mr. Bob has 206 bones. I'm just gonna focus it on the M. It has 206 bones, differing in shape, sizes, and in some cases, composition. The skeleton is divided into two major parts, the axial and the appendicular. The axial bones are the skull, the vertebrae, the sternum, and the ribs, while the appendicular bones are the upper and the lower extremities, including the supporting girdles. So we're gonna start off with Bob's upper extremity, which is the pectoral girdle. This here is Bob's clavicle. This is the sternum. Right here is the scapula. In the scapula, there's fossas. The one is glenoid fossa, and this one is the subscapular fossa. Right down here below is the acromion, and it's the coracoid process, and up here is the acromion. So the clavicle and the acromion joins. This is where we see the AC joint, which is also the acromioclavicular joint. And right here is the sternum, and it joins with the clavicle, so it's called sternoclavicular joint. So as we move along, we're going to point to you the trochlea right here, which is where the head of the humerus is. This is the whole humerus, which is our upper arm. And this is the deltoid tuberosity right here, and down below, down the center is the medial epicondyle, where also this is where our elbow is, and this is where the cornoid fossa is. Cornoid fossa is a depression that receives the ulna and the ulnus cornoid process. So we can also see the capitulum here, which articulates with the radius, and the trochlea, which articulates with the ulna, and the olecranon fossa receives the olecranon process. So that makes the forearm. So as we go down, we would be talking about the wrist, which is also called the carpal bones. So right on the wrist, we would see the scaphoid right here, where the radius is. The trapezoid is here, as well as the hamate and the pisiform and the lunate, where the ulna is. And right here are the metacarpals, and these are the carpal bones, and these are the carpals, and the metacarpals are the small ones. So moving along, we're gonna go to the pelvic girdle area. This is Bob's pelvic girdle. This is the iliac crest, the anterior iliac crest. This is the acetabulum right here. The symphysis pubis is right around this area, and the greater sciatic notch is here, closer to the ischial tuberosity and the iliac spine. There are three bones when we are young that fuses as we become an adult. These bones are the ilium, the ischium, and the symphysis pubis. So at a certain age, these bones just becomes one, and it makes up the pelvic girdle. So as we go down, we would see Bob's femur. The femur is the biggest bone and the strongest bone in in our skeletal system. So right here, depends upon your height. Usually when you're shorter, your femur is also shorter, like me. And this here is his patella, and patella cannot be seen unless you can see the patella better in the x-ray when you go on the lateral side, and then it'll show the patella, which is also part of the sesamoid bone. And right below the patella, where the articulation here, there are a lot of joints here and ligaments around the knee. And right down here is the medial epicondyle. Around here is the shin, what we call the shin. This is the pollex area. This is the tibia, and this is the fibula. So, and right down below is the carpal. It's the metatarsals, and this makes the foot. The tarsal, the talus, the calcaneus. This is the calcaneus right here. The middle phalanges, the cuneiform, the navicular also is right here. A lot of people break this part here when they go snowboarding or things like that. Also, in some rare cases, like right here, you would never know how people can also break their calcaneus for some, maybe their bones aren't that strong. So I hope that covers most of the appendicular bones. And once again, this is April and my model Bob, saying thanks for watching my video. Bye.